I'm Dr. Augusta Uwa, a physician, physician advisor, and founder of ClinEfficiency Pro. After more than a decade inside hospital workflows, I've learned that healthcare does not lack data, rules, technology, or expertise. Clinically appropriate care can still become financially vulnerable when a policy changes, documentation fails to preserve the clinical reasoning, or the evidence required to defend a decision is scattered across different workflows. ClinEfficiency Pro provides the operational intelligence layer between those healthcare decisions and their consequences. Consider what happens when CMS or a payer changes how a service will be reviewed or reimbursed. The rule may be published today, but the hospital's exposure does not begin when a denial arrives months later. It begins when the change is interpreted too slowly, communicated inconsistently, or never connected to the clinical workflow. ClinEfficiency Pro bridges this gap by unifying these workflows into a single intelligence architecture. HALA identifies what changed, translates the policy into structured logic, and shows which service lines, decisions, and revenue streams may be affected. CLIP brings that intelligence closer to the patient encounter. It examines whether the clinical documentation and admission status are sufficient, supporting defensible care and protecting clinically earned revenue by ensuring the evidence is present. Financial intelligence follows what happens to the money. It identifies where revenue became vulnerable, where payment was reduced or lost, and which recurring patterns require an upstream operational change. Claire is the governance intelligence layer across the architecture. She continuously evaluates AI systems, outputs, and decisions. Claire is facility, role, and jurisdiction aware, mapping gaps to regulatory and assurance requirements. Claire identifies missing controls and evidence, supports readiness assessments, and preserves an auditable evidentiary record over time. When a workflow is not sufficiently governed, Claire can pass it, flag it, or block it for human review. The system does not replace clinical or executive judgment. It makes the evidence affecting that judgment visible and actionable. Together, these capabilities form a continuous intelligence loop. This is how clinical truth survives the journey from the patient encounter to payment, and how a hospital moves from fragmented alerts and retrospective denials to earlier, defensible action. ClinEfficiency Pro identifies where revenue becomes vulnerable and whether the evidence and governance required to defend it are present. If your organization is ready to see where that vulnerability exists, visit ClinEfficiency Pro, from clinical truth to defensible revenue.